What is your first year of college like?
My first year of college was fun, exciting. I went to college by myself with no one that I knew. I moved from here and went to UCA, so I learned how to manage money, how to study, because I didn't do that in high school, how to live on my own. It was a lot of learning, but I had some fun along the way too, so it was a learning experience.
At what point in your life did you decide to teach or work in this field?
Well, when I was in high school, I had a best friend that died of ovarian cancer, so I knew then I wanted to do something in the medical field. And so when I got to college, I started in pharmacy, wasn't really what I wanted to do. Took a little while to find radiation therapy, but I finally found it, and I did that for 7 years. I was a radiation therapist, and then I quit to stay home with my first child, and then when I decided to go back to work, it wasn't really a job for me then, so I knew Mr. Winters, and so I said, let's start a radiation therapy program at ASU. So kind of got to do the best of both worlds because I love radiation therapy and now I've got to teach it, so that's been exciting.
What were your biggest mistakes when you were 18 to 22?
Probably not figuring out, well, one, not knowing what I wanted to do until I was about my second or third year, but kind of letting my grades go that first year a little bit, since everything we do is selective admissions. You've got to compete against everybody else, and then when you've got a few not so great grades on your transcript. So probably the biggest mistakes I made were just trying to figure that out. But I think that's what most college students do.
Yeah. What were the best decisions you made when you were in those years?
Best decisions, well, going off to school was good because it forced me to kind of learn to take care of myself, which I had not really known how to do. And then choosing the field that I'm in, because it's been a great career and I've loved it. So I think you really have to love what you do in order to be happy. So I think that was probably my best decision.
What advice would you give to someone who is 18?
Make a plan. You don't have to stick with the plan. It's not about sticking with it, but just having a goal and a plan to work forward towards, and focusing on your grades. You hate to say that because grades aren't everything, but in our world they are in the beginning. To get you where you want to go, you've got to have good grades. But to make a plan, follow it, but don't be scared to change it, because if you need to change it, don't stick with something you don't enjoy. But having a plan kind of moves you forward.
What advice would you give to a freshman in college that is pursuing this field?
Figure out a little bit about what the field is to make sure you understand it, because we're such a small field and not real common. A lot of people don't understand it, so you've got to kind of figure out if that's really what you want to do. And if that's what you want to do, then you kind of just need to set that plan in action, knowing what you need to do to get where. For us, for radiation therapy, it's getting into the radiography program, so setting that as your first goal to keep your grades good enough to get there. And then from there, keeping your grades up so you can get into radiation therapy. But knowing what you're getting into, understanding the field a little bit, job shadowing, just figuring it out to make sure that that's what you want to do. So you don't get to that point and decide, that's not really what I'm going to do, and now I'm in my 4th year. So just have a plan.
What does a typical day look like for a radiation therapist?
Radiation therapists work Monday through Friday, 8 to 5 normally. It's an outpatient kind of schedule because most of our patients are outpatient, and we don't treat on the weekends or holidays. So it's a good schedule. They have patients usually every 10 to 15 minutes. They have a patient, and so it's a matter of getting their patient in, getting them lined up to putting them in their immobilization devices, lining up all the lasers and all the machines to the targets that they need to have, and then setting the beams, and then monitoring the treatment, monitoring the patient while they're under treatment. And so it's pretty quick. It's a 10-15 minute turnover, new patient every few minutes. And so
what is the key to success in this field?
Key to success. I think if you enjoy what you're doing, you'll be successful, because you don't get into this field if you don't really love patients and love taking care of them. So I think just enjoying it, and that it'll go from there.
What's the biggest challenge someone in this job faces on a daily basis?
The biggest challenge would be just dealing with terminally ill patients. Not all of them are terminally ill, but you have to be able to deal with that and everything that they're dealing with in their everyday life, of not being able to work, or having children at home, or not being able to financially provide for their family, or whatever it may be. So you're having to deal with that along with the technical parts of treating them every day.
What is the most rewarding thing about this field?
Oh, definitely the patients. They're so thankful to have someone to treat them. So everybody thinks it's a gloom and doom profession. It's not. The patients are very thankful and happy to be there and appreciative, and so you can really make some. You feel like you're making a difference in people's lives, and you are. So that's definitely most rewarding.